and welcome. I'm Krista Mahr, a healthcare reporter at POLITICO, and I'm pleased to welcome Senator Ron Wyden, a Democrat representing Oregon, to the Harvard Chan studio. This conversation is part of a series called Public Health on the Brink, which explores the most urgent challenges facing public health, as well as promising solutions. Let's start today with mental health. Senator, I know you had a personal understanding of the holes in our system because your younger brother, Jeffrey, struggled with schizophrenia for decades. Could you tell us a little bit about him and how your experience and his experience has really shaped your views of the healthcare system?
It has had a huge impact on me. And there were two Wyden brothers, and he was far and away the smartest. And he had a wonderful heart as well as a really brainy head. And what we saw in our household is, I think, a microcosm of what American families see from across the country. And that is, we would go to bed at night, week after week, worried that my brother would be on the streets and he was going to hurt himself or someone else. And these were in the days when there was even fewer kind of options than there are today. In other words, we have a huge shortage right now of mental health services. For example, in Lane County, Oregon, home of my alma mater, the University of Oregon, if a student in high school, for example, has a tremendous anxiety attack, a variety of mental health problems on a day, there's no arrangement for beds for treatment of that person, that student. And so they're off to the hospital emergency room and very often have to stay there for quite some time. So my brother really was a wake-up call to the dimensions of this problem. And I remember the day that the parity bill was signed. And I said, this is for all the families that have had challenges just like the Wydens.
You have talked about a few things I wanted to dig into a little bit. And one was the shortage of mental health care providers. I guess that there's roughly about 150 million people, so that's about half the US population, that live in an area the federal government calls, a mental health professional shortage area. The Senate Finance Committee that you chair has recently called for more funding for psychiatric training and payments for providers who care for underserved communities. Can you talk a little bit about these proposals and how they will help?
Well, first, I want to make sure people who are following this debate know that this has been a bipartisan effort. For example, in the gun safety legislation, we got 4 of our proposals included, comes to somewhere in the vicinity of $10 billion in terms of the overall amount. This was for Medicaid help in the schools, telehealth provisions, Senator Stabenow's important behavioral health breakthroughs, and then the big prevention program that's in Medicaid. So we're just building on that. In other words, a lot of people wondered when the Congress began whether we were going to be able to get anything done in this political climate. Well, we got 4 major provisions of the gun safety bill that are law today, that have been signed into law. Now, we have continued our efforts with bipartisan policy statements issued about where we're going to go next. And we're, for example, looking at mental health parity. And I'm particularly troubled about these ghost networks. And we're very concerned that we don't have the providers who can meet this enormous need. So we let go our draft proposals last week. And this is part of our commitment to improve mental health care. We would fund new physician residency positions that focus on mental health, expand coverage for mental health services in Medicare, and also take steps to expand coverage in rural health areas. because the isolation in the rural healthcare areas is so significant. So that's a bit in terms of our next steps after the progress we made in terms of gun safety. And you'll also hear us talk a lot more about public-private partnerships. And the model is really in my hometown, the partnership between the University of Oregon and Connie and Steve Ballmer, very well-known philanthropists. We're very proud that Connie is a University of Oregon Duck, by the way. And they are launching a 4-year program in Portland that can take a real bite out of the provider shortage, because they're giving us a model for training students in behavioral health. And I'm going to do everything I can to use this as a model for federal programs. I've done that successfully before. You all covered the Cahoots program, which I got into the Rescue Act in the spring of 2021, which was the first time the Congress had moved on legislation dealing with the mental health challenges on the streets by bringing together providers and law enforcement officials like Chief Skinner in Eugene, Oregon, and the wonderful folks at Whitebird.
For the new proposals that you have laid out, what do you think that the price tag would be to get those things done? And what are the chances of getting the bill passed?
Senator Crapo and I decided early on we weren't going to have the debate about resources and revenue get to the point where we couldn't get out our proposals. Obviously, the challenge right now is to take every moving vehicle in the Congress and attach to them common sense bipartisan proposals. That's what Senator Crapo and I were able to do successfully with the gun safety legislation. So we'll have another opportunity at the end of the year. We'll have another opportunity in 2023. It's our hope. Both Senator Crapo and I are up for re-election, but it's our hope that we'll be able to just keep building on this partnership in 2023.
Another problem that you mentioned already is insurers. So insurers have been required to treat mental health and physical health claims equally since 2008. But the Labor Department says that that's not always happening. And for example, they cite an insurer who will cover nutritional counseling for diabetes, but not for a eating disorder. Insurers can be fined for violating the parity law, but they often say this goes back to the problem of not having enough mental health care providers. So what is it that Congress can do to make that work better?
Well, let me give you an example, because I think these insurers continue to drag their feet and try to find ways to skirt both the letter and the spirit of the parity law. During the pandemic, the University of Oregon Health Sciences Center, the psychiatry department, found that they were having huge problems getting bills paid. They just couldn't get them. They'd submit them and they couldn't get them paid. So I asked the General Accounting Office for a review. They came back and said, this is a serious problem. They're seeing it all across the country. And I put out a press release. It was very small. It was in the Oregonian newspaper, saying I was going to open an investigation into all of this foot dragging and excuse mongering that we were hearing from the insurance companies. And within a few weeks, the University of Oregon Health Sciences Center got a gusher of payments from the insurance companies. So it was clear to me, they knew they'd been dragging their feet. They knew they had a problem, and they figured, well, if a senator asks some questions and he happens to chair the finance committee, we just better, pay up. We can't have a mental health policy or honor the parity law in the country that's only applicable if a member of the United States Congress objects to the foot dragging. So I'm really serious about this. There's got to be consequences for ghost networks, and I want people following this to know what a ghost network is. It's what it sounds like. There aren't any providers there. There aren't any navigators to help people. And if you do find somebody who might actually be seeing patients, seems like they're paying 20 cents on the dollar.
And another thing that you mentioned that I think also certainly plays into this issue of people being able to actually seek mental health care is the youth, mental health crisis, and how staggering that was really before the pandemic and much more so today. And I'm curious, in Oregon, when you travel around the state, what do you hear parents and children telling you about what they're up against?
What people are saying in terms of coverage for young people is there's virtually no there there. We had a young man who's going to go to Johns Hopkins in the future come and say that when the school makes referrals to mental health services, there's virtually no pickup. There's virtually nobody who picks up and says, yes, we're going to follow John and Sally, through the system. So that's why we made a special effort in the gun safety bill on provisions like telehealth and the like, where young people, because of familiarity with digital, we think they're likely to use those kinds of services. But the problem for young people in mental health was serious before the pandemic. It has grown exponentially since the pandemic, and the isolation and the rippling effect has been enormous because the number of young people who had challenges with distance learning and attention, and they were watching families having challenges at home. It's gotten very serious.
Well, let's turn to another important topic that I know is close to your heart also, which is climate change. You have been pushing for years for legislation to reduce carbon emissions in the country. And that finally happened last month after quite a bit of political wrangling when the president signed the Inflation Reduction Act. So I guess the first question is, what was that moment like for you after years of working on this to see such a historic bill get passed?
It really was one of the best moments of my time in public service. I had worked for more than a decade, and the bill that we passed in the Finance Committee in early 2021, sort of the middle of the year, was about 90% of the final legislation. And what it stemmed from was when I was a senior member of the Energy Committee, Joe Manchin invited me to come to West Virginia. And we started talking about the future of energy policy. We came around to the idea of technological neutrality, so that we could say nobody knows what the big carbon emission reducers are going to be 20 years from now. Let's have it science driven. And so the bill that the Finance Committee created and ended up part of the final agreement that everybody saw on TV and the like means that we will have a private sector, market-driven system that is technology neutral. Everything can compete in a private marketplace, and we'll have the idea that I had bounced off Senator Manchin a decade ago, that the more you reduce carbon emissions, the bigger your tax savings. And the reason this was a breakthrough is for 2 decades, people had talked about regulation and they had talked about carbon pricing. But I saw, as chairman of the Finance Committee and as a junior member, there are 44 tax breaks on the books for energy. And most of them were about picking winners and losers. They weren't really about good science. They were about politics. And I said, if we're going to really have a breakthrough, we've got to say, we're going to throw that system, that crazy quilt of breaks that were about political power and picking winners and losers, we got to throw it in the garbage can. And I said, I'm going to try to get as close as I possibly can to doing that. And we now will have a system built around clean energy, clean transportation, energy efficiency. And between now and 2030, it'll get us a long way to meeting the president's carbon emission reductions targets, and getting it back to your beat be a big step forward in terms of public health, because you look at my part of the world and these, wildfires take a huge toll on public health.
Exactly. And I'm from California. So this is something that I think a lot about, both from an individual perspective and really from a community perspective. And I know that, by some estimates, the cost of air pollution and climate change is put somewhere close to like $1 trillion a year for the US healthcare system, which is pretty staggering. What do you think that the US government should be doing now to improve community resilience and really to minimize the risk of climate change continuing to have a worse and worse impact on, both individual and community health?
Well, we need to do more in terms of fire prevention. And Senator Mike Crapo and I, again, we wrote the law that said you can no longer raid the prevention money to put the fires out. But I think we need to do a lot more. I very much favor doing prescribed burns in the cold weather months of the year. But this is also a big mental health crisis that you see in rural areas. I was just on the phone with one of our Lane County commissioners surrounding, rural Oregon in Lane County. And Oak Ridge, Oregon had just had another big fire. And Heather Buck, who's a wonderful commissioner, she had to leave her home again. And the stress that at-risk rural communities face, particularly in Oregon and the West, it can't be overstated, because they're saying, when's the next fire? Will I be next? Will my family lose my home? Will we have to evacuate again and have our lives upended? So tremendous stress. And then, of course, that is also true with respect to the wildland firefighters who put their lives on the line to get the fires under control. And I've talked to the firefighters about mental health issues, and these are incredibly, brave people. And so one of the things we're doing, working with the Biden administration, is trying to get the salaries up to professionalize the firefighter business. But I'm telling you, even in the more urban areas in the West, the Portland, suburbs and the like, you sure see the impact of smoke, wafting through your community from other parts of the state. So the smoke is a serious health concern. It's dangerous to people's, lives, and it takes a huge toll on mental health.
About a week ago here in DC, we had smoke from the Western wildfires, here. I don't know if you were here at that time, but that was definitely happening.
Heard about it.
Is there any, after working so long on this issue and having such a huge win in August, is there a next big climate goal that you kind of have your sights on?
Oh, yeah. I mean, first of all, we've got to deal with the transmission issue. That was when I said we got about 90% of clean energy for America, the bill that passed the Finance Committee, in the final agreement. The one area that we couldn't get was transmission. And it also relates to this permitting issue that people following the discussion know, a bit about, because it's been in the news. We've got to speed up getting solar and wind and geothermal and renewables approved. There's just too much delay, and it harms our effort to hit the emissions targets. So we're going to be working on transmission. And with respect to permitting, my focus is speeding up the process to get that solar, wind, and geothermal and all the renewables approved.
And just while we're talking about the Inflation Reduction Act, another big win in that bill came in drug pricing. And the act gave Medicare the power to negotiate some drug prices. You are on the record saying that's a great start, but there's a lot more to do. What is next on your wish list regarding drug pricing?
Oh, first of all, I want people to know about what's going to happen in 3 days. On October 1st, Medicare is going to begin to apply the Part D price gouging, penalties. It was a centerpiece of the agreement Senator Grassley and I had made in the previous Congress. But under the law that goes into effect in 3 days, if a drug maker raises the price of their product faster than the rate of inflation, they've got to pay the difference to Medicare. So people have said, oh, when's this all going to go into effect? People are going to start seeing that the first real accountability to seniors and taxpayers that Big Pharma has ever faced is going to start in 3 days. In 3 days, there are going to be real consequences for price gouging. And I'm pleased to see that. And what I obviously, want to do is speed up the effort to get the high cost, drugs, particularly the cancer drugs and the arthritis drugs. They're going to be selected next year, the first 10 for Medicare negotiations. I would have liked more. And also at the end of next year, an out-of-pocket cap for seniors in Part D is going to go into effect. And then we're also going to focus on doing more in terms of helping people with insulin prices. I and Senator Grassley, we did a long investigation into this. The insulin challenge shows that the whole supply system is broken down from manufacturer to distributor, everybody. And what we're now able to do is say the Inflation Reduction Act took a big step to help Americans with the cost of insulin by capping Medicare prices at $35. And I don't know how Republican senators are going to explain it, but the Republican senators stripped the provision that I pushed very hard for that would have applied to the same cap to Americans with private insurance. So we're going to keep pushing for that. And we're also going to focus on making sure Part D redesign goes into effect as intended. But, the Senate Finance Committee, I'm so proud of my colleagues. We really did about a decade's worth of legislating in the last few months. If you take, climate, prescription drugs, tax enforcement, and then we're very proud that we got the investment tax credit, more than $20 billion for boosting the domestic semiconductor industry. Those are 4 major bills just passed recently. It was a decade's worth of legislating, and I really credit my colleagues in the Democratic majority and the Finance Committee.
Well, speaking of political momentum, let's turn to reproductive rights, which is obviously really shaping the landscape right now ahead of midterms. You've called for the strengthening of privacy protections around healthcare data and especially reproductive care data. What do you think is at risk there? And why is that such a priority for you?
Well, what I'm concerned about is the Dobbs opinion is so sweeping that women can have their personal data weaponized against them. And people think, well, okay, Ron's got a point in the states that are anti-abortion, for example. I'm making the point that I've been trying to get some accountability over these data brokers. I think these data brokers, this is like the Wild West before the marshals showed up. They can get people's, private data, and it won't just be in states that are anti-abortion. And I'm a privacy hawk, Krista. I mean, I'm proud when people say that, Ron's privacy hawk, and I think reproductive rights are the ultimate privacy, issue. The fundamental right of a woman to control their own body and own their health care is about as private as it gets. And, the day the Dobbs opinion came out, I started making the case about people having their women having their personal data, weaponized against them. And when abortion is illegal, researching birth control online, texting a friend, bringing a phone to the doctor's office, because of these data brokers and gaps in the tracking laws, that all that could be used to track and prosecute women across the country. And right now it's free for all when it comes to things like searching for birth control, visiting a doctor's website. HIPAA doesn't even cover those things. So I really want to commend Senator Hirono and Congresswoman Jacobs with their My Body, My Data Act to create the tough new protections for reproductive, health data. I had a funny experience a couple of days ago with my colleagues, Senator Hirono, Senator Klobuchar, Senator Murray, Senator Duckworth were having a press conference, asked me to come, and I was glad to do it. And they were all, talking, and they looked up at me and said, "We've got some friends, some people who are really supportive of our cause." And they looked up and said, "Yeah, tall guy over here is gonna be with us on these things as well." I'm 6'4", and some of them were significantly shorter. And I said, "Guys, you gave me a promotion. I'm not even a household word in my own household." all over the internet, then I was called tall guy because I was helping women fight for reproductive rights.
Let's see if it sticks.
There you are. There you are.
Do you think that, right now we're seeing a little bit of a shift among some Republican candidates in particular who are kind of excising their more fervent anti-abortion rhetoric from, let's say, speeches?
You think?
It is happening. I'm curious what you think. Do you think that this is something of a reckoning and that the kind of trend towards abortion bans are going to slow down? Or do you think that this is something that's going to just pick back up again after midterms are over?
They know that they're way, way, way out of step with the majority opinion in this country. So they're flailing around. They started out saying, well, we were all about states' rights. Well, turns out they're kind of for states' rights if they think the state is right. So they junked that. And now they're for a national abortion ban, a federal national abortion ban from sea to shining sea. And I got asked about it, and I said, this is the party that was talking about small government. Now we're talking about a federal national, ban. And you've noticed that after Senator Graham started talking about it, a bunch of Republicans started running in the opposite direction. Mm-hmm. Because, I think for a lot of them, this was kind of like the dog caught the car. They would always say that they were, anti-abortion, but it's never going to happen kind of thing. And, there you are. The Dobbs decision, much more sweeping than anybody thought. And, that's why our legislation, the Hirono-Jacobs bill, that I'm proud to be one of the supporters for it would create the strongest ever protections for reproductive information. It says companies have to sharply limit the information they collect and store and share, including location data and internet searches. Now, I propose comprehensive privacy bills for all consumer data, including protections against government surveillance. But following this horrible, horrible decision with respect to Roe, Democrats and Americans ought to say, let's protect women's personal reproductive health data now. And that's what we're trying to do.
One final rapid fire question. President Biden recently declared the COVID pandemic to be over. Do you agree with him?
First of all, as you know, as soon as he said that, the staff said, well, we're still doing this and this and this. So, some of this is semantics. I personally feel that these new variants are going to be a very serious public health challenge. Let me close, and maybe Politico makes some news out of this, because we always appreciate the coverage you give to substance. One of the real sleeper issues is how many health groups, organizations are asking to continue some of the waivers that began for the pandemic. And, we've got expiring health provisions, we got waivers. Sean Bishop and her terrific team over at the Finance Committee are still sorting through all of this. But I can tell you there are going to be some real vigorous political debates about how to sort through these waiver issues at the end of the year. And I'm going to do everything I can to make it policy driven and not just turn it into a kind of political battle royal.
Yeah, as with so many other things with the pandemic, the genie is out of the bottle on a lot of aspects of healthcare. So we'll see how it goes.
We'll continue it when we see you up on the Hill. Always enjoy talking.
Well, thank you so much for your time, Senator Wyden. It's been a pleasure. And thank you to the Harvard Chan School for hosting this conversation. Have a good day, everyone.
Thanks to everybody at Harvard, too. Take care now.
Thanks.